Bismillahirrahmanirrahim. Do one thing every day that scares you, Eleanor Roosevelt. My topic for today is intranatal care, essential and comprehensive obstetrical care. My name is Vida Sharan Sarver, and under my supervisor, Professor Dr. Saida Afzal, I will be presenting today. Learning outline for today is define intranatal care, list the aims of good and effective intranatal care, recognize domiciliary care, emphasis on the care of mother, identify the main complications of this period and restoration of mother's health, principles of EmONC, characteristics of a good EmONC program, 6 United Nations indicators, framework and functions, barriers for effective emergency medical obstetrical care, and differences between basic and comprehensive care. Learning outcome. At the end of the presentation, participants will have a clear overview about the concept of intranatal care, the kind of services and emergency measures that need to be sought if any complications arise during and after the mother delivers her child, and full restoration back to optimum health. They will also become aware of what essential and comprehensive obstetrical care is, its framework, characteristics, and principles, along with the 6 indicators and barriers for achieving optimum care. Introduction. Maternal mortality is not only an injustice, it is also a tragedy to the individual woman, to families, communities, and to our nation. It is a tragedy because women do not die from diseases but the normal process of giving birth. The high level of maternal mortality in Pakistan of 154 per 100K live births in 2023 is strong evidence of the neglect of the health needs of women. The infant mortality ratio is 41 deaths per 1,000 live births. The main cause of maternal death and disability or complications arising from hemorrhage, unsafe abortion, eclampsia, sepsis, and obstructive labor. What is maternal mortality? This is the death of a woman while pregnant or within 42 days of termination of pregnancy from any cause related to or aggravated by the pregnancy, but not from accidental or incidental causes. These include direct as well as indirect causes. Interventions to reduce maternal mortality historically are thought to be traditional birth attendance, antenatal care, as well as risk screening. Current approach is to provide a skilled provider at childbirth and have emergency obstetric care. What is intranatal care? The definition of intranatal care is that it's defined as health care during childbirth, which is a normal physiological process. Many complications may arise during the intranatal period, which includes septicemia, which can occur from the result of an unskilled personnel, and septic manipulations, tetanus neonatal, which results from the use of unsterilized instruments. And the aims of good intranatal care include 3 aseptic techniques, delivery with minimum injury to the infant and mother, readiness to deal with complications such as prolonged labor, antepartum hemorrhage, placental convulsions, malpresentation or prolapse of the cord, etc. Um, then there's care of the baby at the time of delivery, which includes resuscitation, care of the cord, and care of the eyes, etc. The need for effective intranatal care is that there needs to be cleanliness, which includes clean hands and clean fingernails, a clean surface of delivery, clean cutting and care of the cord, keeping the birth canal clean by avoiding harmful practice. Hospitals and health centers should be equipped for delivery. Regular supply of sterile gloves, drapes, towels, cleaning materials, soap, and antiseptic solution, as well as equipment for sterilization of instrument as well as supplies. Domiciliary care. Mothers with normal obstetric history may be advised to have confinement within their homes, provided the conditions in their homes are satisfactory. In such cases, the delivery may be conducted by health workers who are trained females. These are known as domiciliary midwife services. Care of the mother. The objectives of postnatal care are to prevent complications of postpartum period to the mother, to provide care for rapid restoration of mother to optimum health, to check adequacy of breastfeeding, to provide family planning services, to provide basic health education to mother or family regarding this period. Basic health education includes to cover the following areas, which includes hygiene, both personal and environmental, feeding for mother and infant, pregnancy spacing, health checkup, and birth registration. Intranatal care essentially means taking care during delivery. This consists of taking care of not only the mother but also the newborn at the time of childbirth. Appropriate delivery care is crucial for both maternal and perinatal health. Increased skill attendance at birth is a central goal of the Safe Motherhood and Child Survival Mission. Postpartum care aimed at complication free puerperal and a healthy baby. There is a high risk of mortality for both the mother and her baby in the immediate period around birth. High quality intranatal and postnatal care is the important way to reduce the maternal morbidity and mortality. Utilization of intranatal and postnatal services is poor in the rural areas, which ultimately led to increased maternal and child morbidity and mortality. 5 C's, this is asepsis, the concept of a clean chain, which includes clean hands, wearing gloves, clean surface, which is clean and sterile towel to dry and cover the baby, clean cord cut, umbilical cord by a clean and sterile blade or scissor, clean tie or thread for a cord. Do not apply anything to the cord, and universal precaution should apply in every delivery. Concepts, components of essential newborn care at the time of birth, which includes preparedness, immediate basic care, prevention of hypothermia, establishment of breastfeeding, postnatal care, prevention of infection, and detection of danger signs. EmONC is therefore the emergency obstetric care or attention given to both mother and baby to avoid complications and loss of life in pregnancy, labor, and delivery. Emergency care provided to treat and therefore save the life of a woman experiencing a complication of pregnancy or childbirth. Components of EmOC include the administration of parental antibiotics or anticonvulsants, administration of IV fluid using vacuum extractor or forceps to assist vaginal birth, manual removal of a placenta, removing the products of conception following a miscarriage or abortion, and for comprehensive obstetric care, which includes these in addition to performing cesarean section to deliver a baby or giving blood transfusions. EMOC is a package of medical interventions that has been developed to treat the 5 direct obstetric complications, which include obstetric hemorrhage, obstructive labor, septicemia, hypertensive disorders in pregnancy, and unsafe abortion that cause 75% of maternal deaths. It is a subset of emergency obstetric care and refers to the management of complications. Principles to provide knowledge on basic and comprehensive life saving measures to avert maternal and neonatal deaths and disability, to influence in a positive way the attitude of health personnel towards teamwork, to use recommended infection prevention principles for every patient, to provide interpersonal communication skills needed to respect the right of a woman to life, health, privacy, and dignity, to work hand in hand with the community, non governmental organizations, and other stakeholders in responding effectively to EMNOC. Essential obstetric care is used to describe the elements of obstetric care needed for the management of normal and uncomplicated pregnancy, labor, and childbirth. Basic EOC includes the management of a normal pregnancy, labor, childbirth, and postpartum period. Comprehensive includes, in addition to the elements of basic EOC, blood transfusion, anesthesia, and surgical procedures such as cesarean section. Emergency obstetrical care, whether basic or comprehensive, must be available 24 hours a day, 7 days a week. All elements of comprehensive EOC should be available at district hospital, while all elements of basic EOC should be available at basic and comprehensive health centers. Characteristic of a good EMOC program include to exist and function via geographically and sustain equity, used by pregnant women, used by women with complication, provide sufficient and timely life-saving services, provide good quality care, appropriately staffed and equipped, and available 24 hours and 7 days per week. These are the signal functions. The basic emergency medical obstetric care includes parental antibiotics, uterotonic drugs, parental anticonvulsants, manual removal of placenta, removal of retained products, assisted vaginal delivery, and neonatal resuscitation. Comprehensive emergency obstetric care includes all those 7, including the basic, along with cesarean delivery as well as blood transfusion. International goals for EMOC: for every 500,000 population, there should be at least one comprehensive site within 12 hours and four basic EMOC facilities within 4 hours. There should be appropriate geographical distribution of the EMOC facilities. At least 15% of births should take place in a health facility. 100% of obstetric complications should be treated. Cesarean section should be between 5% and 15% of all births. Case fatality rate of direct obstetrical complications should be less than 1%, and skilled attendance at every birth. 6 United Nations emergency obstetric care indicators include Indicator 1, which is for every 500,000 population, there should be at least 4 basic and 1 comprehensive EmONC facilities. Indicator 2, EmONC facilities should be well distributed to serve the 500,000 people. Indicator 3, at least 15% of all births in the community to take place in the EmONC facilities. Indicator 4, at least 100% of women with obstetric complications should be treated in the emergency facilities. Indicator 5, as proportion of all births in the population, cesarean section should account for not less than 5% or more than 15% of all births. Indicator 6, case fatality rate. The proportion of women with obstetric complications admitted to a facility who die, maximum level should not exceed 1%. Calculating all 6 indicators gives you an indication of where the problem lies and where action is needed. Also, these indicators are sensitive to change within months. You can know if your product is making a difference or not. EmONC framework. This framework is a national framework on ways of handling emergency obstetrics and neonatal well-being. This is where we find the Help the Baby Breath program, which is run by an NGO called Tiny People's Matter. EmONC model per district. Each district is supposed to have both basic and comprehensive EmONC services. For 500,000 population, there should be at least 4 basic and 1 comprehensive EmONC services. Barriers for effective EmOC. This includes the 3 delay model, which number 1 is delay in seeking appropriate medical help for an obstetric emergency, which can be due to reasons of cost, lack of recognition of an emergency, or C, poor education or lack of access to information, and gender inequality. 2, delay in reaching an appropriate facility for reasons of distance, underdeveloped transportation, and medical and health infrastructure. And number 3, delay in receiving adequate care when facility is reached because there are shortages in staff, electricity, and water, or medical supplies are not available, or they're inadequate. This is once again a summary of the basic and comprehensive emergency obstetrical care. Basic is performed in a health center without the need for an operating theater. Comprehensive requires operating theater and usually performed in district hospitals. Basic includes management of normal and complicated pregnancy, childbirth, and postpartum period, including IV intramuscular and IV antibiotics, uterotonics, and anticonvulsants, manual removal of placenta, removal of retained products, and assisted vaginal birth. And then comprehensive includes all elements of basic EOC plus surgery, which is cesarean section and anesthesia, as well as blood transfusions. Recommendations. EmOC should be available in root level, increase awareness amongst people. Healthcare providers should be skillful. And number 4, proper screening should be provided. This is basically a quote by Leah Quevedo. It says that every day we hear about the dangers of cancer, heart disease, and AIDS, but how many of us realize that in much of the world, the act of giving life to a child is still the biggest killer of women of childbearing age? Recent advances. The state of routine and emergency obstetric and neonatal care in southern province of Zambia. Abstract. Objective to evaluate the capacity of health facilities in southern province Zambia to perform routine obstetric care and emergency obstetric and neonatal care method. Surveys were conducted at 90 health centers and telehospitals between September 1st, 2011 to February 28, 2012. An expanded set of signal functions for routine care and EmONC was used to assess the facility's capacity to provide obstetric and neonatal care. Results. Interviews were completed with 172 health workers. Comprehensive EmONC was available in only 6 of 10 hospitals. The remaining did not perform all basic EmONC signal functions. Availability, utilization, and quality of basic and comprehensive emergency obstetric care services in Malawi. Objective to establish a baseline for the availability, utilization, and quality of maternal and neonatal healthcare services for monitoring and evaluation of maternal and neonatal for monitoring and evaluation. Objective to establish a baseline for the availability, utilization, and quality of maternal and neonatal healthcare services for monitoring and evaluation of a maternal and neonatal morbidity mortality reduction program in 3 districts in the central region of Malawi. Method: survey of all 73 health facilities that provide maternity services in all 3 districts. And the conclusions were that the total number of the EmONC facilities is adequate, but the distribution is unequal, leaving some rural areas with poor access to these services. Coming to MCQs. Question number 1. EmOC is emergency obstetric care or attention given to mother and baby to avoid complications and loss of life in pregnancy, labor, and delivery. Surgery and blood transfusion is included in what component of EmONC? A. Basic, B. Comprehensive, C. Exclusive, D. All round, or E. Detailed.
B.
B.
Yes, the answer is B. Question number 2. Intranatal care means care taken during delivery. This consists of taking care of not only the mother but also the newborn at the time of childbirth. What are the 5 C's of the asepsis concept of clean chain? A. Clean hands, clean surface, clean cord cut, clean tie, thread for cord. B. Clean sheets, clean waste space, clean hands, clean clothes. C. Clean scrubs, clean baby clothes, clean delivery room, or clean tools. D. Clean cord cut, clean room, clean waste disposal area, or clean water. Or E. Clean water, clean space, clean hands, or clean tools.
A.
Yes, the
A.
answer is A. Mothers with normal obstetric history may be advised to have confinement in their homes, provided the conditions in their homes are satisfactory. In such cases, the delivery may be conducted by health workers who are trained females. This is known as A. Antenatal care, B. Postnatal care, C. Domiciliary midwifery services, D. Screening, or E. Hospital service credits.
C.
Yes, the answer is C. Question 4. Maternal mortality is not only an injustice, it is also a tragedy to the individual woman, to families, communities, and to our nation. It is a tragedy because women who do not die from diseases but from the process of simply giving birth. What is the 2023 figure for maternal mortality in Pakistan? A. 30 per 100K live births, B. 5 per 100K live births, C. 100 per 100K live births, 154 per 100K live births, or 700 per 100K live births.
A.
A.
The answer is 4D. Question 5. Emergency obstetric care is used to describe the elements of obstetric care needed for management of normal and complicated pregnancy, labor, and childbirth. 6 United Nations EmOC indicators exist. Which of these is the first? A. For every 500,000 population, there should be at least 4 basic and 1 comprehensive EmONC facilities. B. The proportion of women with obstetric complications admitted to a facility who die maximum level should not exceed 1%. C. Facilities should be well distributed to serve the 500,000 people. D. At least 15% of all births in the community take place in EmONC facilities. Or E. As a proportion of all births in the population, cesarean sections should account for less than 5% or more than 15% of all births. The answer is 5A. Question 6. Death of a woman while pregnant or within 42 days of termination of pregnancy from any cause related to or aggravated by pregnancy but not from accidental or incidental cause is known as A. Fertility rate, B. Maternal ratio, C. Maternal mortality, D. Maternal morbidity, or E. Maternal care.
C.
Yes,
E.
the answer is C. 7. Comprehensive emergency obstetric care includes all of the following except A. manual removal of placenta, B, hysterectomy, blood transfusion, cesarean section, or removal of retained products?
B.
Yes, the answer is 70. A, shock is out of proportion to the amount of bleeding in a 1 year postpartum hemorrhage, B, retained placenta, C, acute puerperal inversion of uterus, D, hyperfibrinogenemia, or E, cancer. The answer is B, retained placenta. Question 9. Intranatal care is defined as healthcare during childbirth, which is a normal physiological process. Many complications may arise during the intranatal period, such as septicemia, which results from unskilled personnel in septic manipulations, and tetanus neonatal. B, ectopic pregnancy. C, placenta previa. D, antiphospholipid syndrome and stillbirth. Or E, urinary incontinence and urinary retention. Now, the answer is A, septicemia, which arises from unskilled personnel. Question 10. What is the first step in management of shock according to the emergency obstetric neonatal general management? A, give oxygen at 6 to 8 liters per minute by face mask or nasal catheter. B, cover the woman with a blanket to ensure warmth but do not overheat. If the woman is not breathing, begin resuscitation measures. Turn the woman to her side and ensure her airway is open. Or E, check the woman's vital signs, temperature, pulse, blood pressure, and respiration every 15 minutes. And the answer is 10D. This is my key. These are my references. And this is the link to the YouTube channel. Thank you.